Hello, this is Vicki Ribsam, Joint Replacement Nurse Navigator at Concord Orthopaedics, and this is your module on activity and rest. Do I need physical therapy? So that's a question that I get very frequently from people. Do you think I need physical therapy after I've had my total joint replacement? So if you are having a total knee replacement, it is very important for you to continue to see a physical therapist after you leave the hospital. Most patients continue to see an outpatient physical therapist in a clinic, usually near their home, when they leave the hospital. If you have not set up those appointments for after your surgery, and you have your surgical date, please contact your surgical scheduler, or you can contact me to make sure that we send orders off to the outpatient therapy center of your choice so that you can schedule those appointments to happen 2 to 3 times a week for 4 to 6 weeks after surgery. We do tell people it's good to start your physical therapy approximately 3 days after surgery, just so that you can stay on target and stay working with a physical therapist after you get home. If you are in the hospital or the clinic after surgery and you are experiencing a slower recovery, if the skills that you would need to be safe at home are difficult for you in the hospital, the care manager in the hospital will order home physical therapy for you in between leaving the hospital and starting your outpatient therapy. If they order home physical therapy, you'll have a home therapist visit you 3 times a week for 2 weeks. Again, that is arranged when you're in the hospital. It does slow down the recovery a bit. It does mean that your community goals will have to wait until you start your outpatient therapy after the 2 weeks. If you are having a total hip replacement, you do not need to see a physical therapist after leaving the hospital. Your recovery after a total hip replacement is very much based on whether or not you do your home exercises and maintain your walking program. There are some occasions where physical therapists are important after a total hip. Sometimes when people have a slower recovery in the hospital, the care manager in the hospital may order 2 visits a week for 2 weeks with a home therapist, and then you can be on your own exercise program. Then occasionally, sometimes people come back to the office for their 1-month visit after surgery and are still struggling with some of the skills that they need to be active in the community. If that's true, your surgeon may order physical therapy for you at your post-operative visit. So how much activity do I need to be doing at home? So whether or not you've had a total hip or a total knee replacement, it is very important that you get up and walk every hour during the day. So while you're awake during the day, you should be taking a short walk. Your outcome is very much based on the frequency of your walking, not necessarily the distance within those first couple weeks. So make sure that you have space to walk. You only need to go a couple steps, although we will encourage you over time to go further. You should also be performing exercises that have been prescribed to you by the staff at the hospital or the clinic. How much rest do I need? It can be difficult to sleep at night. We do encourage people to attempt to sleep at night. Try not to do exercises when you're supposed to be resting, and try to sleep in your bed if you can. It can be difficult for the first couple weeks. There are some things that you can try in terms of listening to music, reading a good book, deep breathing exercises, and relaxation. You should also be resting in between activities. So while you're up and walking, you should be doing your exercises. When you're ready to sit down, you should be prepared to rest. Rest is an important part of the healing process. When you're resting, you should elevate your legs. It is common for people to experience more swelling and some bruising that can happen about a week after surgery. That swelling is very responsive to elevation. The more you swell, the more you elevate, meaning you do it longer and put them up higher. So ice and elevation are critical. Ice is also helpful for pain and swelling around the incision. Whenever you're resting, remember your ice and your elevation. Do I need a walker? Different people need different equipment at home. Most people go home and use a walker for a week or two. That is used to help people relearn the walking without developing a limp. You also will need a cane for stairs, and then when you're finished with the walker, you will need a cane for balance. You can buy or borrow walkers or canes before surgery. There are lots of ways to borrow. There may be senior centers, lending closets in your town. Make sure that you reach out to friends and family who may have had surgery to see if you can borrow something. If not, walkers and canes can be purchased at pharmacies, Walmart, Amazon.com, pretty much everywhere. Do you need other adaptive equipment? Sometimes. Some people do benefit from shower benches, shower chairs, raised toilet seats. It isn't necessary. You may find that you like it after surgery. I do recommend that you wait until after surgery to decide that you need it. And if you do need it, you can always purchase those things the same places that you would purchase a walker, pharmacies, Walmart, Amazon.com. If you have any questions, please reach out to me, Vicki Ribsam, Nurse Navigator, Concord Orthopaedics.